What's up, y'all? I'm gonna make this pretty quick. Uh, for those of y'all that don't know what I do for a living, I am a nurse. I've worked in hospitals, nursing homes, emergency rooms, long-term acute care hospitals, cardiac floor, neuro floor, med surge, wound care. I've done a lot. I've seen a lot. Uh, and this coronavirus is the first time I've been scared or nervous. Some of y'all may have been watching the news, some not, but uh, just to let those of y'all that watch my channel know, those of y'all that are friends, acquaintances, people that just pop by. Latest from the CDC, in case y'all didn't hear last night, is that this virus is airborne. That means it can survive floating around the air for 2 or 3 hours. Somebody that's infected can go into a Walmart, get their stuff, and leave. And we all know that people without symptoms can spread the disease. So somebody goes in there in Walmart, they breathe, they talk, virus exit their lungs, floats around in the air. Somebody else comes by 2 hours later, and it can infect them. So uh, I think at some point, uh, our government is going to recommend people wear face masks. I am recommending strongly, if you're out in public, wear a mask of some kind. Yeah, everybody wants those N95 masks. I'm a nurse. I can't even get them. I lucked out. This car I'm in, this was my mom's car. When she died, I got the car. Well, last week I was cleaning out the trunk because I got a flat tire. Start moving stuff around. Lo and behold, I found a old open box of N95 masks. And before you ask, am I going to donate them to hospitals? Nope. I'm a nurse. I need those for my patients. And it's only a box of 20. It's already been opened. There's some missing out of it, so I'll probably have maybe 16, 15. So they're not, there's water stains and all kind of stuff on the box. But I don't care. I'm still going to use those when I see my patients. I'm doing home health now. So my responsibility is keeping the patients I see healthy and isolated. And the only way I can do that is to wear a mask when I see them. I don't even have full protective equipment. I don't have gowns. I don't have access to gowns doing home health. I get gloves. I get soap. Usually I get hand sanitizer. I'm not getting hand sanitizer right now. Not that it would matter. I don't use this stuff. I wash my hands 150 times a day. But here lately, I'm wearing gloves to pump gas, gloves and mask to go get groceries and toilet paper that I can't find. So I would recommend y'all all do the same thing. If y'all are out in public, wear gloves, wear a mask. The mask is probably more important than the gloves because this virus is airborne. They thought it was droplet like the flu, meaning you cough, mucus comes out of your throat, lands on something, somebody else comes by and touches it. That's not the case. They're saying now you can pass this just by breathing and talking, and it'll stay in there for a couple hours. So, you know, y'all be careful. Our government has done this wrong from the start. I would suggest you quit listening to politicians and reporters and start listening to the doctors and nurses that show up on the news to try and tell y'all what's going on. That's all I got. Y'all be careful, stay safe, wear a mask. You leave your house, put on a mask. I'm doing more than recommending it. I'm telling you, if you don't, you're stupid. It ain't got to be an N95 mask. You can't find them. I can't find them. I'm using old dirty ones that have been in a trunk of a car for 3 years. But cover your face with something. Those paper masks, go get, one of those big plastic air filter masks that people who paint cars use. It doesn't matter. If you have something, if you can find something, a scarf, does not matter. Put something over your face. That's it. Heading to work. Uh, you know, nurses aren't off of work right now. Doctors aren't off of work right now. People are calling us heroes. And you know what? I don't know about any other doctor or nurse, but I did not get into this line of work for the money. I didn't get into this line of work to be labeled a hero. I got into this line of work because I want to keep people alive. That's it. My father died because of medical staff screw ups, and that led me to this. My only interest is that when I leave at the end of the day, my patient is still breathing and healthy. I'm not getting rich. They're talking about upping doctors and nurses' pay. Well, that'd be nice, but you know what? It doesn't matter. I'd still be going to work every single day. As far as calling us heroes, cops, firefighters, the military are our heroes. Doctors and nurses, from my point of view, we're just doing our jobs, man. That's it. We all signed up for this kind of stuff. We all knew it was going to happen sooner or later if we work in the medical field. And we all knew the country was woefully unprepared. That's it. Seriously, that's it. I'm tired of ranting. This thing got me scared, y'all, and has from the start. Uh, first Donald Trump said it won't come here. Then he said just a few people have it. The whole time I've been saying, nope, that ain't how disease spread works. And then he said we were going to open back up by Easter. And I said, nope, that's not how it works. Now he's saying April 30th. Well, guess what? They're estimating that the peak of infection in Texas, where I live, is around May 4th, May 5th. How are we going to open back up on April 30th if the peak is going to be in May? Seriously, guys, don't listen to politicians. Don't listen to the news. Listen to doctors and nurses. Plan for the long term. I'm planning for months. Months. I'm planning for 6 months of this crap. If I'm wrong, great, wonderful. I will be happy to be wrong. I would love to be wrong and everything to open back up at April 30th, but it's not going to happen. Do you know why it's not going to happen? Because the country hasn't shut down. And I'm talking nationwide. Louisiana shut down. Texas pretended to shut down, but it hasn't. At least my area, there's still people going all over the place. Small town, middle America, they're not going to shut down. So you're going to have one area decreasing the curve while another area's curve is increasing. Because every county, every state, every city is doing something different. Some people are requiring masks now, I heard yesterday, or you get a fine. Some people aren't even putting in social distancing. Governor of Georgia just yesterday said that, oh, we're just finding out that you can spread it without having symptoms. Oh, his dumb ass just found that out. The rest of us knew whenever this thing came out in China, before it even got here. That's why I said don't listen to politicians, don't listen to the news broadcasters, listen to the doctors and the nurses that they're interviewing. And stay safe. My rant's over. I'll see y'all in the next one.